Dear colleagues, greetings from New York, from the United Nations Statistics Division on this fourth day of the second expert group meeting on the impact of COVID-19 on census taking in the world. This is the final stretch. This is the final day that we will be tackling today, and we did have indeed, in at least my mind, an extremely fruitful and productive 3 days. We listened to a number of countries sharing with us and with all of us the examples of conducting the census in the midst of the pandemic, and the adaptations that are necessary to be undertaken in order to ensure not only the proper conduct of the census, but also to ensure the quality of the data. We did discuss those adaptations. We did discuss switching to the modes that preclude direct contact with the interviewers, primarily the self-enumeration either via internet or via the mail-in, mail-out questionnaires. We have discussed also that this kind of change in the middle of census taking really requires a very careful approach and elaborate testing, making sure that these changes in the methodologies and the techniques for data collection do not have a negative impact on the quality of the data. We have also discussed the impact of the COVID-19 in a more broader sense, in the sense of what the census is going to present once the data are released to the usership, and whether these discrepancies, especially in the time series compared to previous censuses, will have an elaboration that would make sure that the census really provides a proper snapshot of the impact on the pandemic, not only on the census, but on a society as a whole. We also discussed, and that was the topic yesterday, the various undertaking of countries in terms of ensuring the quality of the data and the quality of the operations. We have heard from Australia yesterday that they were able to achieve the expected 95% response rate. They did have issues with certain categories of population, the certain layers of population, primarily the homeless population. But then they did apply a number of methods in order to ensure the quality of the data, including the microdata editing and microdata editing as well. The post-enumeration survey that was run to 0.5% of the households. And they also are exploring at this point of time the combining administrative sources in order to ensure the quality of the results. Canada also undertook and described how they undertook a number of instituted a number of mechanisms for ensuring the quality of the enumeration itself. The design was really driven by the COVID-19 pandemic, and then it was made in such a manner that the direct contact between the enumerator and the respondents is achieved only when really absolutely necessary, and even then with the proper use of the personal protection equipment. In order to ensure the quality of data, Canada also applied the imputation for administrative sources. And what is really very important, again, it is on the level of a small area quality assessment by providing adequate tabulations. Hong Kong, China, a special administrative region conducted the census also this year. It was a multi-mode census, a combination of internet response and the direct interviews with the respondents. In many cases, in order to ensure the full coverage, the enumerators had to be dispatched because of the peculiarities of the housing conditions and situation in Hong Kong. The editing rates and the imputation rates will be provided to the users to better understand the quality of the data. Slovakia did a census also this year in 2 phases, and they did apply the standard the standard measures of ensuring the quality of the enumeration, including, of course, the paradata and the information of the supervisors. They are also now just in the process of processing the data. UK also presented their processes for ensuring the quality of data, and this is really a number of tests depending on the phase of the enumeration that ensures that the coverage is complete, but also that we have a full imputation of the missing values and the missing data, as the UK census, actually the census in England and Wales, is actually producing estimates. The US displayed a number of operational activities that would ensure a full coverage of the population in US. They extended the enumeration period in order to ensure that all those living in the country are counted, and this also has been then checked under and introduced a new procedures, including the proxy response, in order to have as full coverage as possible. And the data are already released for the most immediate needs, primarily for the restructuring of the electoral districts. Then we turned our attention to what is also extremely important, the impact of COVID-19 on the census data and how we are going to present this to our users. Canada presented a whole step that is still really underway, because the enumeration took place only in May this year, and they are now conceptualizing how best to present the data in the context of COVID. They are relying on they will be relying on other statistical inquiries to contextualize the data that are coming from the census. There will be additional explanations to the usership and the stakeholders as a whole. Latvia described really in a very precise manner the impact of COVID-19 on the results of the register-based census conducted in Latvia. The census date was the 1st January 2021, and they really documented how COVID changed the density of the population of certain districts. The commuting, of course, is the lack of commuting essentially changed very much the way that the people decided to live and to settle down. And then the impact on birth is really striking, and then it is a huge decline in the number of births during the pandemic. So this was yesterday, and I believe but I know for sure that all the presentations are available on our website, and then of course we will also post the recordings as well of today as well. The recordings of the previous 3 days are also available there. Today we will have our colleague from Tajikistan presenting the Census of Tajikistan that took place this year, if I'm not mistaken, and then I will. Unfortunately, we do not have the participation of China. I believe this is some kind of technical glitch that prevents us to communicate directly. But they submitted the presentation, so I will run the presentation so that we have also an information about what happened in China during the census this year, and after that, we will turn our attention to the conclusions and recommendations. They were distributed to participants yesterday, and then they were posted also on our website for all interested colleagues to peruse. Very well. So I will then stop here and then ask whether there are any comments, suggestions, proposals, complaints, if you wish. I see no hands there. Thank you very much. So then we will proceed as suggested. I will then ask Mr. Nezov to please take the floor, Tajikistan, and share your screen. Mr. Rizaev?
Just a minute. Are you seeing my screen?
Yes, we can see your screen.
May I start?
If you can just put it into slide mode, that will be even better.
It's okay?
It is okay. We are now on slide on the first slide. So please go ahead.
Thank you. First of all, I would like to say thank you for UNSD for inviting me to participate in this expert meeting groups. I'm very pleased that I was given the opportunity to make a presentation about the population census in Tajikistan. I hope my presentation will be interesting. I prepared a short presentation, but I think it will be very interesting. The next page contains first of all, I will tell you how we prepared for the population census in 2020 during the pandemic and what difficulties we encountered. I will tell you how we done a population census during a pandemic. Also, we are doing what is the moment. After that, I talk about the role in international organizations that assist in conducting our population census and the dissemination results population houses census 2020. The pandemic found Tajikistan one of the last in the world. Therefore, before the onset on morbidity, we counted to the preparation for the population censuses. All the preparation work went according to plan, and we had everything ready to complete the list of houses. We plan to carry out this work in two stages. First of all, we first complete list in one part of the country. Everything went as planned, but after the completion of the work in the first stage, we developed a disease and begin to grow. The State Commission for the Control of COVID-19 disease has ordered to suspend all activities in the country, and we were forced to stop all work, but the preparation in statistics did not stop. After 2 months, our situation became stable, and we were given consent to conduct a second round of listing and houses. After the completion of this work, we begin to form an organization plan for conducting the population census. In this regard, we divided cities and districts into census instruction and enumerated area. So it was calculated how many workers we need in order to conduct a population census. I would like to inform you about the preparation work to help State Commission for the promotion of the population census. All ministries and departments were interested to help agency on statistics. For the preparation and conduct of the population census, we begin a full-scale campaign of exploratory work. For the same, we had trained everyone to anti-COVID propaganda. During this work, we prepared a video, audio, radio broadcasting on the topic of the population census was posted banners to attract the population to participate in the population census. More than 20,000 workers were involved in the population census. The training was carried out in 3 stages. For census chief, supervisor, and enumerators, the training was carried out in strict compliance with all the requirements for the spread of disease. Of course, at this time, there was a mobility, but situation was calm. I would like to inform you that there was no quarantine at all in our country. Only there were restrictive measures. Conducting a population census was very important for us, but the health of the population was on first step, and temporary worker we were provided a lot of antiseptic protection, disposal masks, and disposal gloves. During this training, we separately strongly recommended how to conduct a census in pandemic. From October 1 to 15, 2020, we conducted a population census. We use mixed methods for the census. We use copy, and PAPI. For the passenger for internet census, a separate site was created in which it was possible to pass the census. Of course, a methodology on how to fill census form and was uploaded on this site, as well as phone number where could get additional information. Internet, the instruction of the state commission in the passenger of the census through in the internet, active participant of all ministry and department as well as population. Due to the fact that they did not want to contact people, they began to actively pass the census via the internet. This was not only in urban area, even in the rural part. We mainly use the tablet in urban area. For this, we were provided with 3,500 tablets. In the rural part, we use paper forms to conduct population census. For your information, more than 75% of the population of Tajikistan live in the rural part. We also have multi-countries, so we use paper questionnaire. During these days, the situation was stable, even people start not wearing masks. For conduct population census, we use 6 form were prepared and reproduced. In this census, we use 2 new forms. First of all, a new form, separate form, questionnaire for temporary foreign citizen and form, and another form for disability for the population and difficulty life in every day for each person. We use the questions of the Washington groups of questionnaire: hearing, vision, working, remembering information, and focusing attention. At the moment, we are processing population census materials, how you say, paper questionnaire. We organize 3 centers for processing census materials. During processing materials, we use scanning methods and using a software for purchases. It is planned to complete the processing by the end of the year. Of course, during the preparation and for the census, international organizations help us in every way. The Agency on Statistics has been working closely with UNFPA for over 20 years, and they were one of the main donors and even attracted other international organizations to help the statistician in conducting various seminars for census specialists, in carry out mass explanation work, for preparation a video and audio clips, various leaflets for the census, provision of temporary work with antiseptic disposal mask, technical assistant, as well as provision of software for scanning, processing of census materials. And other donors, UNHCR and UNICEF, they help us in data processing. we planning to disseminate the results population and household census 2020. We will be prepared 10 volumes, monograph, various thematic collection, analytics report, and other publication. At this moment, we're also thinking about the platform which was prepared for our Belarusian colleagues. I would like to point out the platform includes not only one census data, but integrated via GIS data. Thank you for attention. If you have some question, I will be answer for your questions. Mr. Sergey?
Thank you. Yes, thank you very much, Najmuddin, and congratulations to you and your team for successfully conducting the census in those circumstances. It's really, again, our appreciation for you to participate at our meeting. I'm now opening the floor for any follow-up questions for Tajikistan. So the floor is open at this point of time. I would start with the first question for Mr. Rizoev. You mentioned that you intend to develop a platform for the dissemination of data. So my question is, obviously this will be an interactive platform, but do you intend to have an interactive mechanism for constructing the tables, or this will be only the maps that you will be presenting with the different indicators? So that is the first question. Any other questions, please raise your hand.
May I answer your questions?
Yes, please.
So a week ago, we know Belarusian colleagues get a platform for Belarusian statistician preparation and platform, and we learn how it's done. In the month, we're planning to visit to Belarusian and know how this platform will be done. And we only see in website how they preparation this platform, but I have not details how there is added some indicators, or I don't know. But we only see how this platform is very useful for simple users, because it's very important for dissemination information via internet by platform.
Thank you very much. Yes, we are familiar with the platform now that you mentioned. Thank you. Any other questions for Tajikistan? Please, the floor is open. I see no hands at this point of time. Very well. If you do have later on any comment or question for Mr. Rizoev and Tajikistan, please use the chat box or the email, and then we will do our best to entertain your questions. Again, Najmuddin, thank you very much for your presentation and for taking part in this meeting. Let me now share my screen and just go through the presentation from China. I believe it's useful to have an information about how China conducted the census, even although we cannot really have, for I am sure just technical reasons, the direct participation from the China Bureau of Statistics. The presentation is loading up right now, so please just a few moments of patience. Very well. Can you see the screen?
Yes.
Very well. So then let me just go through the presentation that was submitted by China. In terms of census planning, this slide here provides the 6 major points that were taken into account for the census planning, which is a scientific angle, then the necessary angles inherited, which means comparing with the previous censuses, creative use of administrative records and big data, among other possible, what is possible, which is the survey costs and data availability, and what is feasible, which refers to the efficient convenience means and the clear structure of the questionnaire, including the language used for formulation of the questions. The purpose of the census is to cover the mainland residents and Hong Kong, Macau, and Taiwan residents in China and the foreigners. Then there is a second class of population of interest, which are the Chinese population temporarily abroad, like the diplomats and so on and so forth. The foreigners living in China staying in China for the short period of time were excluded from the census count. The census day and hour was November the 1st, 2020 at midnight, and the contents of the census form were referring to the name, the ID number, unique ID number, sex, age, ethnicity, education, industry, occupation, migrational status, marriage and fertility, deaths in the households, and housing conditions. So what Chinese colleagues did, they developed 2 types of the questionnaire for mainland China residents, the short form with 19 items for all households, basic status of household and its resident population, and then a long form, 48 items, which and the sample was 10% from all the households. In addition to what is on the short form, adding the information on housing status and marriage, fertility, and so on and so forth. Then there was the form for people from Hong Kong, Macau, Taiwan, and foreign countries, very similar to the short form, but even shorter, only 16 items. And then for deaths, there were 8 items, basic information of death 1 year before the standard time of census, before the census moment. Of course, we know that the population of China is among the highest in the world. So is the country itself. So census districts nationwide were divided into over 6 million enumeration areas, and then all the buildings have been geo-referenced according to what it says here. Over 7 million enumerators were employed. The vast majority of them, 3.8 million, community worker, 44%, and then there were other volunteers and secondment personnel and so on and so forth. So over 7 million enumerators. The short form was administered in households from 1 to 15 November 2020. And it was a real-time reporting. What we see here is a kind of a dashboard that allowed the census managers to have an understanding on the process, the proceeding of the operations of the enumeration of the population in China. The long form was administered from 16 to 30 November, and the selected household, we said it was 10% of the total number of households, were then collected, and then they were put into the electronic collection terminal for the census enumerators. The PAS, the post-census quality check, took place from 14 to 20 December. And this is an independent survey. It was run on 32,000 households, 100,000 persons, and the under-reporting rate, according to the post-enumeration survey, is 0.05% of the total. These are some numbers of the total population, 1.4 billion as it stands. Right now, the growth obviously is going down, is decreasing, and this is the population growth rate according to the censuses. The sex ratio is now, as you can see, close to 106, 107 rather, which is then a slight, I would say, decrease from the previous census there. What is also quite noticeable is that the proportion of children and elderly population is going into opposite directions as presented in the slide here. Another conclusion is that the level of education has improved significantly. Average years of education are almost 10 now. There are much more people with higher education, and the illiteracy rate dropped to 2.7% of the total. The size of the family households continues to shrink to 2.62. Now, this part of the presentation is focusing on the impact of COVID-19 on the census. So as it says here, the health and safety of the households was of most paramount interest, of course, of the government. They organized, obviously, the training by using the remote mechanisms there and the video conferences and online training and guidance. This is one example of the training and how it was conducted. Again, we have to remember we had over 7 million enumerators, so the training was indeed massive. Some of the measures in high-risk areas, they would stop the census until the circumstances allow, set up registration station outdoors like the one here that is presented, and encourage the self-reporting of the respondents. For the low-risk areas, the remote areas here, special precautions were taken that the enumerators do not come in contact with the population that is at low risk, and then possibly make it more difficult for the population there and the respondents. Overcome the impact of the COVID-19 pandemic and successfully complete the census. There was a minimal impact of the epidemic on China's census data. It can be ignored in the presentation. And this is the last slide with a thank you. So I just thought it would be useful for all of us to have an understanding how the census in China took place, and I thank our Chinese colleague for submitting this presentation. We will not post this presentation up until we receive a permission from our colleagues from China, but at least you now have the understanding on how this went. So unfortunately, I will not open the floor for comments and suggestions because I won't be able to entertain them. Let me then now just move to the final piece of work that is before us. And this is the discussion on the conclusions and the recommendations of this second expert group meeting on the impact of COVID-19 on census taking in the world. We will now upload the 3-pager that we dispatched yesterday to the participants, and then we will go para by para, and then until we have an understanding that we are all agreeing with the conclusions, the recommendations. Those will be, as I've said, presented to the Statistical Commission as a background document, but will be also taken into account for preparing the report of the Secretary General for the purpose of the March session of the UN Statistical Commission. So, Seife, would you please upload the text?
Yeah, there is some technical issue when I was trying to upload the Word version of the conclusions. It was telling me I cannot upload a document, a file of that type. So only PowerPoint is permitted to be uploaded. So give me 1 minute to copy what's in the Word into PowerPoint. Just
okay.
one. Yeah.
Okay. Okay. So apologies for this, and then let us have a few minutes of break.
Surgeon, it will take some time because the fonts are different when I copy from Word into PowerPoint. The font size becomes too big, and then I have to individually select the text and reduce the font size, etc. So I don't know if you want to if everybody has a copy in front of them, maybe we can read it and go through it.
Yeah. Let me just.
Surgeon, would PDF work?
PDF should work.
PDF,
yes.
yeah, yes. I don't have Adobe Acrobat, so I cannot convert my Word into PDF.
Well, do you want me to post it on chat?
Can you? Yeah, and you can upload it, Andrea.
Okay.
And then you will scroll through it, and then we will take the notes.
Okay. Okay. So. It doesn't allow me to post it on meetings chat, so I send it to you and Surgeon on Teams chat. You can check.
Okay.
Safe, do you see it?
Yes.
Okay.
No, I tried to upload it, and then it's telling me only PowerPoint files can be shared at this time. File type is not supported.
Very well. Dear colleagues, apologies for this. We will then, you did receive it.
Let me just share the screen, not the document itself. Let me try 1 second. But I will not be able to control it. Can you see it?
Yes, we see it. Okay, fine. Thank you very much. Very good. So, dear colleagues, the idea here is to essentially go through the conclusions and recommendations, first from the point of view of general comments, if you have any, which means whether something here is missing, or there is something that we have put here and that was not discussed at the meeting itself. So I am now opening the floor on in terms of general comments. Are there any general comments on the way that we have put together the overall conclusions and recommendations, in whether something is missing here is the primary concern? So the floor is open for general comments. Very well. Yes, Ian, please go ahead.
Thank you, Serjan. My camera's not working, so you won't have the pleasure of seeing me. For those that don't know me, I'm Ian White. I'm used to work for ONS on the UK census for many years, but I'm now an independent consultant, and I take a particular interest in this particular session, this meeting. So thank you very much indeed, UN, for inviting me. And I must say I've enjoyed the 4 days conversation and discussions very much indeed. I'm not sure I've got comments that I want necessarily for you to implement into the conclusions and recommendations, but I'm wondering if I may take just a minute or two, if you can indulge me, on just some general observations that I have noted as a result of all the discussions that we've had over the last 4 days. Some of them are relevant to the census generally, but some of them are obviously inspired by the fact that countries have had to change their methodology because of COVID. So I've just got 5 points that I would like briefly to make. I don't need you to comment back on them, and you may or may not wish to take note of them in your documentation, but I feel happier if I've just given my views. And one of them is, I think it came out during the discussion with Canada, and it was a clarification between, and it was all about imputation. I think there's some confusion, or there needs to be a distinction made between donor imputation, where you're using administrative sources to identify the characteristics of a missed household, and then you use donor imputation as you would do normally. There's a distinction between that and where you're actually using the unit records from the administrative data to impute into the census. Now, these are both imputations, but they are different sorts of data sources. And I think when you're talking about imputation using admin data sources, it's always, I think, advisable to make a clear distinction how the admin data is actually being used. Because the second category is in fact a combined census, because you're using the actual data from an admin source. So maybe it isn't imputation in the real sense of the word. Various countries have had to use different modes of data collection: CAPI, CATI, CAWI, PAPI, and we heard from Tajikistan this morning that they do so. I always think it is important that the effect of modal bias between collecting information using sometimes very different data sources should be examined. I did raise this in chat a couple of days ago in connection with the Italian census, and I'm pursuing this with Geraldo independently, but I think the effect of modal bias hasn't really been discussed today. More generally, in moving to a new methodology, and particularly to react to an emergency like COVID, it is important that the users be fully discussed and be fully aware of these implications for quality. If the data does not meet the user's needs in terms of quality, then it's not worth collecting in the first place. I think the importance of the user input into discussing the methodology should be stressed. I've raised this, I think, with you separately, at least with Miriam separately, but there was at one point during the meeting on the second day when I was confused as to whether data collection using CAWI, which is where you're using an online website to conduct an interview, and online self-completion, as is done in Australia and UK, for example, I think there's some confusion as to the distinction between these two types of data collection. And I think when we're talking about using CAWI, which has been used, and I think is a good method to use to stop door-to-door collection, I think we need to make a distinction between that and what is effectively online data self-completion. And finally, just a note. I can't help it. As some of you may know, I have a great interest in historical censuses, and I can't help but think that 2021 round is not unique. It only takes 100 years ago, when the 1920 round of censuses, particularly in the UK, I was going to say I remember, but of course I don't remember, but I know there was a great concern that the demographic situation in 1920, as a result of the Spanish flu, and of course the disruption to settlements after the First World War, there was a great call that 1920 one census should have been cancelled. So this COVID situation is not new. It's just repeating what has been done 100 years ago. So I just thank you for indulging me on those comments. I hope they've been helpful.
Thank you very much. Thank you. Thank you very much, Ian, for your comments. Of course, they are right on the mark, and then we will certainly take them into consideration while finalizing the conclusions and recommendations. I would just like to point out that we do elaborate on the multi-mode bias in our handbook on the use of contemporary techniques for census taking. This is the handbook that we have issued a year and a half ago. And we have a chapter that is discussing the multi-mode bias there. So we definitely are understanding and fully focusing on those issues. And indeed, the errors that you will have when you combine for example, the paper questionnaire and the records collected with the tablets, the errors are definitely not the same. And this is something that has to be taken into account. Thank you for that one. We are also taking note of we did discuss the user's need for metadata. Then you are focusing on the input side, which is a valuable one. And then thank you for this reminiscence about what happened 100 years ago. We are definitely really, I believe that each generation experiencing a very peculiar situations that definitely build up into the common understanding of how best to address the calamities and the contingencies here. However, I think that this one is, I would say, unique because it is universal and does not affect one or two countries, but obviously it's spread all over the world. But thank you very much for your comments. We certainly will be taking them into account while finalizing this piece and further documents as well. The floor is still open for any general comments on the conclusions and recommendations, so please go ahead. Very well. Let me now go through the documents para by para. What we intend to do here is to put the paragraph for discussion, and if there are any comments on that very specific paragraph, then we will address it accordingly. So, any comments on para number 1? Ian, I have your hands up. I believe that's the old one, or do you want the floor again?
No, that's an old one. Sorry.
That's all right. Thank you. Comments on para number 1? Number 2? Number 3? So I have here in the chat box Monique. Monique, would you please make your comments? Is it on para number 3?
Yes.
So include the raised cost of telecommunication for telephone interviewing and data for mobile devices. That is your comment on para number 3, right?
Correct.
Thank you very much. We will definitely incorporate this. Unfortunately, we don't. Yeah, here it is. Include raised cost of telecommunication for telephone interviewing and data for mobile devices. Yes, right on the mark. Thank you very much. Any other comments on para number 3?
Yes, Chair. Georgia from Australia. One of the things I heard, while not in Australia, a number of countries mentioned that it wasn't just increased costs, but their budgets were restricted or reduced because of the government need to spend money elsewhere. So it was a bit of the double whammy of increased costs, but also budget pressures and reduced budgets.
Thank you very much. Right on the mark. Yes, we will include that. Indeed, quite a few countries were facing this quandary here, and that was really difficult for them to resolve. Thank you. Any other comments on point on para number 3? Thank you. Let's move to para number 4. We can perhaps go in pairs. So any comments on paras 4 and 5? Six and 7? Eight and 9? Ten and 11. I have in the chat box Monique point 10, the difficulty of eliminating double records when using different collection methods. Yes, oh, very well. Thank you. Any other comments on 10 and 11?
There was one, Georgia from Australia. There was a discussion in the chat box around administrative data and being careful around a lag in updating of records and the changes in how the records are managed due to COVID. So just while using it, being understanding the context or how that data might be changing during the same time.
So the question of actually having up-to-date administrative records due to the COVID pandemic.
Yes.
And
so
how up to date they actually are.
Yes.
Very well. Thank you. Yes, we will incorporate that. Any other comments on 10 and 11? 12 and 13? $14 and $15? And 16 finally. Very well. Thank you. Thank you very much, colleagues. With this, I think we can conclude that we have adopted the conclusions and recommendations as amended right now by all of us. Thank you very much for this. Again, we are going to finalize the conclusions and recommendations, incorporate the comments, and then distribute them later today. And then we will also post it on our website. So which brings us very close to the completion of this meeting and the conclusion of this meeting. Before we conclude the meeting, I really would like to ask all my colleagues from UN Statistics Division to turn on their cameras. I would like to introduce, there is a number of people behind the scenes that are working very hard to maintain this kind of meetings, and I really would like for you to have a glimpse and to have an understanding of all of my colleagues here. Mariam Demirci, who is our interregional advisor, Predrag Savic and Hiroki Ogawa, statisticians. We do have also Andrew Smith, a colleague, Vladimir Korovkin, behind the screen to assist us. We do have Seife, who is the focal point for censuses in UN Statistics Division. We have a number of colleagues that are not switching their cameras on, but they're very much supporting the meeting, like Andrea and Davet. We have N2 and Chinkyu. So there is a whole section here, a good dozen of people that were all very much active and supporting this meeting. And on behalf of all of us, we thank you very much for your participation. We believe that this was an extremely fruitful meeting, an extremely necessary meeting for all of us to have a good understanding what are the challenges that the countries are facing in conducting their national censuses. We are going to document all of these and put this into the documentation that we will share with all the colleagues as we move on. Please use of our resources that we have on our website and let us know your opinion regarding the usefulness of the documentation that we are providing. And if you would like to see something that is not there, please let us know and we will do our best to find to meet your needs. So with this, without further ado, all the best from the UN Statistics Division from New York. Thank you all for participating at this meeting and looking forward, hopefully, to have this kind of meetings in person that I believe is something that we are missing very, very much. Thank you and goodbye.
Thank you.